Members of the American Legion family, it gives me great pleasure to introduce our next speaker. Sloan D. Gibson was confirmed as Deputy Secretary of Veterans Affairs on February 11, 2014. Prior to joining VA, he served as President and Chief Executive Officer of the USO, and before that he spent 20 years in banking, retiring in 2004 as Vice Chairman and Chief Financial Officer of AmSouth Bank Corporation. He has a long history of service and leadership with nonprofit organizations. Mr. Gibson is a 1975 graduate of the United States Military Academy. He holds a master's in economics from the University of Missouri at Kansas City and a master's in public administration from the John F. Kennedy School of Government at Harvard University. Ladies and gentlemen, please give a warm welcome to the Deputy Secretary of Veterans Affairs, Sloan D. Gibson.
Lower that just a tad. Hope that's okay. I hope you have the same feelings after I finish that you had before. We'll see. See how I do. Last December, at our Denver medical facility, a distraught veteran took VA nurse practitioner Kathy Rittenhouse hostage. Armed with a loaded pistol and 2 boxes of ammunition, the veteran's stated purpose was to be killed by police. Suicide by cop. Experienced and highly trained, Kathy calmed the veteran and persuaded him to let her make a phone call. When VA police officer Greg Crenshaw arrived, Greg persuaded the veteran to take him as the hostage and let Kathy go. In the process of taking Kathy's place, Greg disarmed the veteran and resolve the crisis without any physical harm to anyone. The whole process took 13 minutes. Now, I want you to stop and think for just a minute how easy it would have been for Kathy and Greg to wait for the police that were already on the way, to wait for the hostage rescue team, to wait for the SWAT team, thinking, this is really not my job. That's not what they did. They acted based on their commitment to caring for veterans. They acted on their desire to do the right thing and their very considerable training in de-escalating just such situations. In doing so, I believe that they saved lives. There's a quick postscript here. After the crisis was over with, the team got together and requested that this veteran not be sent somewhere else for his inpatient mental health care. They wanted to take care of him there. This is who we are. Now, you wouldn't know that by reading the headlines. We live in a world where bad news, crisis, scandal are much more captivating. So it's no surprise that we don't see press reports about how many lives are saved by the dedicated health professionals who work for VA. But that's the kind of story that I often hear in my visits to VA facilities across the country. Speaking of visits to VA facilities, I was in Denver about 10 days ago. Funny how that happens. I've spent a lot of time in Denver the last couple of weeks, the last year and a half. While I was there, I presented awards for valor to Kathy and Greg, and I also presented Distinguished Service Awards to several others who helped make that all possible. Bob and I have visited hundreds of VA facilities in less than 2 years. We visit with frontline staff at every single facility, and I'll tell you what we find. We find employees that care deeply about our mission, that do the right thing, and that work hard every day to serve and care for our veterans. Now, when I took over as the acting secretary 21 months ago, one of the things that I did was consult with people that knew a whole lot more about running a healthcare system than I did. One of the first people that I talked to was Dr. Harvey Feinberg. Harvey had just stepped down after 12 years as the president of the Institute of Medicine, a distinguished global reputation as a distinguished healthcare leader. We were talking about the situation that we were in at the time, and I told him, I said, Harvey, I think we've got the opportunity to do some things in the next 2 or 3 years that otherwise would have taken the department 2 or 3 decades. He quickly disagreed with me. He said, no, VA's got the opportunity to do things now it never could have done. I think Harvey was right. VA has an extraordinary opportunity, and we are determined to seize it. We're taking ownership of our problems, and we're building back the trust of veterans by making lasting progress, including in access to VA care. We've expanded capacity by focusing on staffing, space, productivity, and care in the community. VHA staffing is up by more than 14,000, including 1,400 more doctors and 4,000 more nurses. We've activated 4 million square feet of space in the last 2 years. We've increased authorizations for care in the community by 46%. Clinical workload is up 10%, and that's measured the same way it's measured out in the private sector. That doesn't sound like much, does it? 10%. A 10% increase in a healthcare system the size of VHA translates into roughly 20 million additional hours of care for veterans. The result, 96% of appointments are completed within 30 days of the veteran's preferred date, 85% within 7 days, 22% of our appointments are completed on a same-day basis. It's a lot of same-day access to care. What I think too, average wait time, 5 days for primary care, 7 days for specialty care, and 3 days for mental health. What do veterans think? That's really more important. What do veterans think? We've just recently, and some of you may have noticed this, the kiosks that we have out in all of our medical centers where you go to sign in when you're coming into the clinic. We've started asking a very simple question. How satisfied are you that you got today's appointment when you wanted it? Simple question. Just in the last several weeks, nearly 500,000 veterans have responded. 89% said either satisfied or completely satisfied. Less than 3% said dissatisfied or completely dissatisfied. Now, I'm not happy that we got nearly 3% that are saying they were dissatisfied. That means we got work to do. But I got to believe that if I could look at that statistic for the private sector, I got a hunch that that would compare pretty favorably. What's been happening in the meantime is we've been working to improve access to care. More and more veterans are coming to VA for more of their care. They come for the quality, they come for the convenience, they come for the camaraderie, and they come oftentimes because it costs less. Their out-of-pocket costs are lower. So even though we're completing millions more appointments inside VA and outside VA, the number of veterans waiting for appointments has actually gone up. So we've got work to do. Since 2009, we've hired 9,000 more mental health clinicians. That boosts their ranks by 65%. Staffing for the Veterans Crisis Line has grown by 1/3 since 2014. We now have 388 staff there, and we're in the process of hiring 85 more to handle the growing volume of calls. Since the launch of the Veterans Crisis Line in 2007, they've answered nearly 2 million calls. This is interesting. Nearly 1/4 of those calls were answered last year in 2015. The same phenomenon is reflected in referrals to local VA suicide prevention coordinators. There have been 320,000 referrals since the creation of the Veterans Crisis Line. 1/4 of those were made in fiscal year 15. Crisis Line counselors dispatched emergency responders to callers in crisis more than 11,000 times last year. In 1 year. They've done that 53,000 times since 2007. Since adding chat and text services, they've engaged nearly 300,000 veterans or concerned family members. These aren't just numbers. I've been there in the crisis line, standing next to a responder, taking care of a veteran in crisis. It's happening every day. This past Christmas, a crisis line counselor answered a request for a veteran whose wife had died in the past year. This was the first Christmas in 27 years she wouldn't be with him, and he was depressed and needed someone to talk to. It turned out that this particular veteran had called the crisis line before, and at that time, he had already decided that he was going to take his life before his daughter woke up in the morning. He talked to Cynthia, a crisis line counselor, and she changed his mind. Remembering that moment made him want to contact the crisis line again and thank Cynthia for bringing him back, in his words, from the dark side to the bright side. This is who we are. Maybe you saw the recent USA Today article about the Veterans Crisis Line. Pretty hard to miss when it's the banner headline. What the article didn't say was the IG report that the article was based on was based on 2-year-old data. It didn't talk about the staffing increases that I just mentioned to you. It didn't mention the crisis line's change in leadership that, quite frankly, I put in place. It didn't go into the added space, the extra training, the improvements in call center technology, the changes in business practices, all of the things that we're doing to make sure that every single veteran who calls in crisis talks to a trained, experienced VA responder dedicated to getting the caller the help that they need. This is a top priority. I had one of my folks check my calendar this morning. I've had 34 meetings with Veteran Crisis Line chain of command in the last 13 months. That's what a priority it is for us. I'll be back at the crisis line for another visit on Friday. So one of the things that I would ask you is you take on board some of that additional context. Think about that the next time you read an article in the paper. There is, most of the time, an awful lot more to the story than what you see reported. Let me shift gears to the Veterans Benefits Administration. As you all know, the backlog, disability claims backlog, is down 90% from the peak, 611,000 back in 2013. I'm delighted to report to you, average days pending in our entire disability claims backlog, 91 days. 91 days. And we've got the lowest inventory that we've had since 2008. I've said many times, tell me of another major part of the federal government that has transformed more for the benefit of the people that it serves than VBA has. And I've yet to have anybody suggest an alternative to VBA. Having said all that, I do want to take a moment to provide a little bit of context. As you would expect, all of us, we want to see the backlog come down some more. It's down 90%. It needs to come down more. We want to see appeals decisions made more timely, especially those in the early stages. We want to see dependency claims expedited and cleared more quickly. Takes too long to decide a dependency claim today. We want to see VBA meet their standards that they established for routine redo of fiduciary conduct out in the field. And lastly, I would tell you, and this is a hot button for me, I want them to answer the darn telephone when it rings. You know, I will clap for that one. As many of you know, over half of the time when a veteran calls one of our VBA call centers, veteran doesn't get through. You don't even get into the queue. That is absolutely unacceptable. Now, here's the harsh reality. And this is something that I've been talking about for quite some time, and this is a perfect example. Part of what we have an obligation to do as leadership, part of what we're taking ownership for, we've got to align resources with requirements. So one of the things that I've told Danny Pummel, our acting Undersecretary for Benefits, Danny, I want you to come sit down with me. He was supposed to do it on Friday, but I'm going to be in Canandaigua, it said, so we'll probably do it on Thursday. I want you to take, now that you've got a 2016 appropriation, I want to see exactly how you have allocated that appropriation. And I want you to translate that into the level of service you're going to be able to deliver to veterans. And I've got a hunch he's going to tell me we can't reduce the backlog, reduce dependency claims, reduce appeals, improve fiduciary review, and answer the telephone, all 5 of those things. That's what he's going to tell me. Now, we've got an obligation to do everything we possibly can do with the resources that we've been given. And so I continue to push hard on improving productivity. But even if we could overnight improve productivity 10 or 15% with the resources that we have, we wouldn't scratch the surface. So part of the story that needs to be told, and once we've been through that, once I've been through that process, I want to make all of that very visible, especially to our VSO partners, so that you've got the opportunity to see, here's how we're allocating the resources we've been given, and here's what it translates into. And it may be that we've got a drop call rate that goes from 60% to 40%, and I think that stinks. But at some point, something's got to give here. And you need that kind of visibility just like we need it, and we need to be able to tell that story. What about veteran homelessness? We built a strong and productive collaboration among the Department of Housing and Urban Development, the Interagency Council on Homelessness, VA, the public sector, state government, local government, non-governmental organizations, private sector nonprofits, and for-profit organizations, and of course our veteran service organizations like the American Legion. Since 2010, the results of that collaborative effort, homelessness is, I think you know, down 36%. Total homelessness. Veterans living on the street down roughly 50%. I think a lot of that flows from a winning strategy. It's called Housing First. It turns the old conventional wisdom on its head. It used to be that you didn't put a homeless person into some kind of housing until you took care of the alcohol addiction or the drug addiction or other problems that a veteran may have. Now the idea is get them housed and then wrap around them the kind of care and support and treatment that they happen to need. Since 2010, over 260,000 veterans and family members have been permanently housed, rapidly rehoused, or prevented from falling into homelessness by our programs and by Housing and Urban Development's HUD-VASH vouchers. For homeless veterans that we've housed, emergency room visits are down 28%, inpatient hospital stays down 30%. So we're not just getting veterans off the street, we're healing minds and bodies and making better use of resources so we can serve more veterans. Accountability has been an issue. Am I stating the obvious here? For a lot of folks, I have to say, I think this is really about how many people we've fired. Now, in all my years in the private sector, I never encountered an organization where leadership or management excellence was characterized by or measured by how many people you fired. And there is a pretty simple reason for that. You can't fire your way to excellence. To turn any organization around, you have to inspire people to do better. You have to recruit and retain great talent. And you can't do either of those two by capriciously punishing people on the basis of rumor, innuendo, or press reports. We are holding people accountable, firing those that warrant it, more than 2,000 over the last 18 months for poor performance or misconduct. We also take other disciplinary actions that are appropriate for the offense and supported by the evidence, and that we hope will withstand appeal. More about that in a minute. One of the areas that's gotten a lot of attention, and appropriately so, back in the summer of 2014, we did a field access audit. We identified 113 different locations where we found some kind of irregularity that was enough for us to say we need to go take a follow-on look. Wasn't identifying 113 locations where there was misconduct, just where there was something that didn't look right around scheduling practices. The Office of Inspector General has closed out 77 investigations related to those. So first of all, that means we're still waiting on another 30 or 35 reports to come in. In 62 of those 77 cases, there was some issue identified. And in the vast majority of those, the IG found no misconduct. In fact, it's the criminal IG that's gone and investigated these, found no misconduct. Instead, what they found was that people just weren't trained properly. The Office of Accountability Review found evidence of intentional misconduct warranting discipline in 10 facilities. 28 people were implicated. All 28 have been disciplined, and the disciplines range from removal, demotion, suspension, reprimand, etc. Where evidence confirms misconduct, employees are being held accountable. Now, I would be remiss if I didn't take just a minute to talk about some of what's been in the news in the last, especially in the last 24 hours, or the last 2 or 3 weeks, some of it. As you look at my decisions that have gone to the MSPB, the Merit Systems Protection Board for appeal, it seems as though I'm batting both 1,000 and 0. In the last 3 cases, in all 3 cases, the judge sustained the charge. And at the same time, in all 3 cases, the judge deemed my punishment unreasonable. Now, frankly, I don't think that is consistent with congressional intent under the Choice Act. All 3 of these were handled, as all of our senior executive serious disciplinary matters are handled, using the additional authority that Congress gave us under the Choice Act. I don't believe that kind of overturning of the discipline is consistent with congressional intent. As you would expect, that puts us in an extraordinarily difficult position. When we have senior executives that have committed misconduct, the charges have been sustained and they've been returned. And so I will do the very best I can do to do the right thing for veterans in every single one of those instances. But I doubt seriously that I'm going to please or satisfy anybody in the process. Now, the one thing that we have done, we had asked Congress previously to consider, give us the legislative authority to make all of our medical center directors and network directors Title 38. We asked for that principally because it gives us additional flexibility on hiring on the front end, and it also gives us a little bit of flexibility around compensation so that we could be a little bit more competitive. Frankly, the other thing that it does is it removes those executives from having appeal rights with the Merit System Protection Board. They still have an appeal right, but the appeal right is inside the department, not to a second agency. We have now asked Congress to make all of our senior executives Title 38 so that we have both that flexibility on the front end of employment and also on the back end. And that recommendation has been warmly received by both the House and the Senate, but we'll keep working it. So having said all that, I need to quickly add in here, discipline isn't all there is to accountability. To transform an organization, Bob and I talk about sustainable accountability. It means making sure people understand what their job is, making sure that they've got the wherewithal, the resources to be able to do their job. Make sure that we're working to overcome obstacles. Make sure that they get regular feedback on performance and that, in fact, where it's warranted, that corrective action is taken. I'd like to give you a great example of sustainable accountability inside the department. We have a program, it's called SAIL, S-A-I-L. Many of you may have heard of it, Strategic Analytics for Improvement and Learning. SAIL is the tool that we use to measure veteran health care outcomes in every single medical center we've got. It measures things like patient quality, care quality, patient safety, patient satisfaction, among a number of other parameters. Shortly after arriving at VA, I learned about SAIL, and out of curiosity, I looked into the correlation between the veteran healthcare outcomes as measured by SAIL and the performance evaluation of the respective medical center director. What I found, instances where there were stellar performance ratings at some of the poorest performing facilities. So beginning in October of 2014, we integrated veteran healthcare outcomes as measured by SAIL into the performance contract of every single medical center director. What happened? SAIL, first of all, SAIL became one of the most widely used management tools in the entire department. Funny how that happens, isn't it? And much more importantly, 60% of our medical centers improved veteran healthcare outcomes over the course of the year. That's sustainable accountability. How good is SAIL? The chief medical officer of one of the largest healthcare organizations in America came in, took a look at SAIL, and he said, if I had this, I would implement it in my organization today. It's that good. That's sustainable accountability, delivering better outcomes for veterans, not just right now, but for the long term. So that's a little bit about some recent progress. Let me talk for a second about where we're headed. As many of you know, we have a major cultural and organizational transformation called MyVA, focuses on 5 key areas. Improving the veterans experience. We want to see a seamless, integrated, responsive customer service experience every time. That's right, you heard somebody from VA talking about customer service. That's what this is about. That's the heart of this, delivering that great veteran experience every time. Second, improving employees' experience by eliminating barriers to excellent customer service. Third, improve some internal support services so that we enable our frontline staff, but we also deliver a better financial result for taxpayers. Fourth, grow a culture of continuous improvement so that we're rapidly identifying problems and quickly replicating solutions around the country. And then last, strengthening strategic partnerships, building innovative networks of collaborative relationships across the federal government, with state and local government, with our nonprofit partners, with VSOs, further strengthening those relationships, and even for-profit organizations. One of the ways that we're doing that is helping communities around the country establish what we refer to as community veteran engagement boards, to bring together local veteran service providers and advocates to improve outcomes for veterans and their families. These are community-driven organizations, not driven by VA, but led by local civic and business leaders. They give veterans and their families a forum to address and promote opportunities for collaboration, and they aim to resolve issues and help all of us better meet the needs of veterans in the community where service actually gets delivered. We've already stood up 39 of those. We've got 16 more in the pipe, and we hope to have 100 established by the end of 2016. We've made leadership changes as part of the transition under MyVA. 10 of our top 16 executives have joined VA since the summer of 14, all 10 bringing extensive business experience into the organization. We've identified 12 breakthrough priorities to continue improving care for veterans, and we've included those in our 2017 budget request. Speaking of that, the President proposed a $182 billion budget for 2017. It's a strong budget, $65 billion for veteran health care. That's a 6.3% increase over 2016. Includes $12 billion for care in the community, $8 billion for mental health care. One of our priorities is to ensure that when veterans call for a new mental health appointment, they receive a suicide risk assessment on the spot and immediate care when it's needed. The budget supports modernizing our contact centers so that we can answer the phone like we were talking about earlier, as well as the Veterans Crisis Line, so that veterans can more easily access VA systems. It funds hepatitis C treatment for an expected 35,000 veterans to the tune of $1.5 billion. It provides $8.5 billion for long-term care, $725 million for 36,000 caregivers. That's a 20% increase. It supports increased disability exams at all of our regional offices. And it includes a 42% increase in funding for the Board of Veterans' Appeals, which will result in a 35% increase in board staffing to work the growing inventory of appeals. More on that in a minute. Funding isn't all we need. The budget request includes more than 100 legislative proposals to overcome obstacles we face in trying to serve veterans. 40 of those proposals are new for this year, and some are absolutely critical to us, especially in terms of our ability to purchase care in the community. Here are a few of those. Top-to-bottom transformation and streamlining of VA's care in the community programs, based on the roadmap that we presented to Congress back in October. Urgent changes to VA's Purchase Care Authority. You'll hear it referred to as provider agreements, so that thousands of our veterans who are receiving care in the community can continue to receive that care without interruption. General Transfer Authority that gives us the ability to move internally up to 2% of our discretionary budget so that we can allocate resources where they're most urgently needed to care and serve veterans. Flexibility on the maximum 80-hour pay period requirement for certain medical professionals. Imagine trying to run an emergency department where all of your physicians were bound by 2 40-hour work weeks in an 80-hour pay period. That's how that has to run. Think about how you would staff an emergency department when you have to run time and salary and compensation like that. The authorization for 18 leases and 8 major construction projects that were actually included in previous budget requests, plus 6 additional leases, 2 major construction projects, and 4 cemetery projects. And finally, legislation and funding to implement a modernized appeals process. Let me talk about that for a minute. The present process was conceived over 80 years ago, and it's unlike any appeal process anywhere, not just in the federal government, but basically anywhere. From a veteran's perspective, it is complicated, it is not transparent, it's opaque, it's unpredictable, and it feels like an adversarial interaction between veterans and VA, the exact opposite of what it's supposed to be. The average processing time for an appeals decision in VBA, 3 years. At the board, the average time is 5 years. Who thinks that is delivering the service that veterans deserve? I sure don't. Many appeals are much older. Last year, the board was still adjudicating an appeal that originated 25 years ago. It had been decided 27 times. And that's not just a sole outlier. There are many that have been out there for 15, 20, 25 years that have been decided dozens and dozens and dozens of times. I do not believe that's the right thing for veterans or for taxpayers, either one. I think veterans deserve an appeals decision within a year of filing a notice of disagreement. Now, we've proposed a straw man, and it's nothing but a straw man that's in our budget submission. Verna and I have met and talked about this, as I have with all of our major VSO leadership. That idea, it's really nothing but an idea, but it's a marker that sort of demonstrates the kind of change that we think is possible right now. The simple fact of the matter is our claims and appeals process, and the other thing that has come from those conversations, you can't look at appeals alone. You got to look at claims as well. And that's precisely what we're doing. That's precisely what the group has agreed to do, meeting with the subject matter experts from all of the major veteran service organizations and a few of our subject matter experts to see if there's an opportunity to come up with a claims and appeal process that's right for veterans. Easy for a veteran to understand. Transparent, so the veteran understands where he is or she is in the process. Fair, and delivers a timely resolution so that the veteran's able to take care of that and get on with life and what life is all about. That's what we're after. Now is the time. I would tell you, I didn't bring the quote with me. Just last week, we got a note from the president, and it said, roughly quoting, as you're working with Congress and our VSOs, I hope you are leaning in on appeals reform. It is absolutely critical. It's something we've got to do. That's the President of the United States, and I sat in the Roosevelt Room with him a few months ago where he personally committed his investment in trying to make this happen. No hidden agendas. Everything's on the table. Let's figure out what makes sense for veterans in claims and appeals. The time to act is right now. Right now. Let me close with another quick story. In December, VA nurse Sharon Levinson up in Brattleboro, Vermont, noticed that one of her regular patients didn't show up for a scheduled appointment. Now, it would have been pretty easy for her to do nothing and enjoy the fact that she had a slightly lighter workload that day, but she didn't. She called the patient. He didn't answer the phone, so she called the VA police. Now, the VA police doesn't normally respond in instances like that unless there is an explicit belief that there is harm to the veteran or harm to others. But they didn't follow that rule. Police Chief John Richardson tasked Officer Guy Gardner to go investigate. So Officer Gardner couldn't reach the veteran either. He called the patient's emergency point of contact. That person reported back when he went to the door, he didn't get an answer. So Officer Gardner called the local police and requested a welfare check. Local police entered the home and found the veteran unconscious but alive. He was rushed to the hospital where he was revived and began his recovery to good health. He likely would have died, but for 3 VA employees who cared enough to go the extra mile. This is who we are. 1 . 1 . 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1 We still have a lot of work to do to ensure that every veteran gets the kind of experience that we all want the veteran to receive. But we are making progress. With your continued advice, with your support, we will continue to make that progress. Please, when you meet with your representatives in Congress, remind them of the things that veterans need Congress to do. Remind them that veterans need Congress to grant the President's budget for VA. Remind them that veterans need Congress to act on our legislative priorities, especially provider agreements. And finally, veterans need Congress to legislate and fund a modernized claims and appeals process so that we deliver the kind of benefits experience that veterans deserve. The one other thing I would ask as a personal plea, please let them know that you know that there's more going on inside VA than what you read about in the newspaper. There is, in fact, a lot of great work that happens every single day. It doesn't diminish the opportunities that we have to improve. Those exist, and we've got to own those. But there's a lot of great work, and you all know that, and your members know that out in the field across the country. Please let me extend my both congratulations and gratitude to your National Commander, Dale Barnett, Brett Reistadt, the legislative chairman, but I think you're the event chairman for all of this. Bless you. Dan Wheeler, Verna Jones, we're delighted to have the opportunity to work with Verna day in and day out. Sharon Conister and Kevin Collier, thank you all for your leadership, for your dedication, for the difference that you all make for veterans day in and day out. And thank all of you as leaders of the Legion for the difference that you're making in the lives of our veterans, their families, and their survivors. Thank you all very much for this opportunity. Thank you. Thank you.